Well, we're going to get started. If everybody wants to come on in and grab a chair. So I want to thank everybody for coming tonight, and we have had some great turnout for people braving the Minnesota cold to be here tonight, and I want to thank everybody for that. I'd also like to thank the People of Hope Church for hosting the event this evening. So, yep, let's give them a round of applause. Thank you. Thank you. We got a thumbs up from back there. Yep. So tonight's gathering, it's focused on the affordability and access to comprehensive health insurance. And specifically, we're going to be talking about legislation that passed last legislative session, and it's the expansion of MNCare and how our community support to ensure that we keep this program a publicly administered option. So let's say that again. We want to keep it a publicly administered option. Now, my name is Toni K. Manskow. I've been a volunteer with Isaiah since the year 2015. And this past fall, there were many of Isaiah members in our community, which it's a faith-based organization, but many members in our community, we held listening sessions with over 500 people to get an idea of what issues they feel are very important. And healthcare was one of those. So healthcare, specifically quality, affordable, accessible, comprehensive health insurance plans are needed. And that's what many of the people in the public were saying to us. So these conversations took place with family, friends, and many of our neighbors. So tonight you're going to hear from some of the individuals that we've talked with from our local community that will be sharing their stories. And then we're going to have that followed by our local elected officials, along with, we're very honored to have our Commissioner of Commerce here tonight to speak with us. And so once again, we want to welcome everybody for coming, and we will have a great conversation. So what I'd like to do now is I'd like to invite up Senator Liz Bolden, and then we'll have Representative Tina Liebling, and then our Commissioner of Commerce speak for just a little bit, because what we want to do prior to hearing from members of our community for their local experience, what their experience has been, we want to kind of get a grounding of what the legislation is. So Representative Liebling, if you want to come up, Senator Bolden. Yep, here we go. Yeah.
All right. Good evening. It is so good to see so many faces here. This is great. I'm glad to have a full room. Anytime I can talk with folks about healthcare, I love to do it. So I am really grateful to be here. So I'm Senator Liz Bolden. I serve in the Minnesota Senate. I am a nurse of over 20 years, and so that's the other hat that I wear. I'm going to talk a little bit about public option. And I just again want to say thank you. I'm really grateful to those who are going to share their stories tonight, because that is meaningful and impactful and why we're here. So public option, briefly, is meant to be an expansion of MNCare, as was described. So we value healthcare in Minnesota and value having access and affordable healthcare for folks, and have a program here in Minnesota, MNCare, which covers lower income folks. It's a good program that covers all parts of our body, including vision and dental and all of those things that need care. And so the public option would be essentially an expansion of that, to expand the pool of folks that are covered by that program. We passed a bill last session to sort of continue that process. Healthcare is very complicated and complex, and doing anything to change our system takes time. There also are connections to the federal government. We get some dollars from them. And so to change things, we oftentimes need to ask them, get a waiver, or ask them if we can change some of those things. So in order to sort of move that process forward, we passed a bill last year to continue that process. Right now, the Department of Commerce is working on a report that will be released at the beginning of February that will provide us information on sort of options of what that public option might look like. What the costs might be, who should it cover, what would be covered, these types of things. And so really grateful to have Commissioner Arnold here today to speak as well. I will just say, as I am talking to folks, there are pieces that I want to be sure are included in that public option. We want, as was mentioned, we want it to be a true public option. Putting more people into the hands of private insurance companies is not going to help people. We know that insurance companies are more often than not a barrier for people to get care. And my colleague Representative Liebling is going to talk more about that as well. So building the true public infrastructure for this program. So it needs to be truly public. We want to be sure that it is covering all parts of our body. So vision and dental, all of that should be included and covered in the program. We want to be sure that it is affordable for people, that we know that just having insurance coverage does not equal in health care. If people can't afford it, it's not helpful. So making sure that those premiums continue to be affordable. And probably, in my vision, should be on a sliding scale based on what people can afford and what their income is. We want to be sure that there's not a cost sharing for behavioral health care and substance abuse treatment, which is the same as what Minnesota Care is right now. Want to be sure that there are generous options for in-network coverage for who is covered. Again, it does not help if you have coverage, but you cannot utilize it. So especially as we talk about greater Minnesota and, especially rural areas, there are gaps. There are people who cannot access care. And so making sure that that coverage is sort of widespread and accessible. And then we want to be sure that reimbursement rates are such that it is a viable system for providers. So we'll look for that report beginning of February. At the legislature, the session will be having much more conversation about what that means, what that looks like, and how we move it forward. I want to be really clear that this is not like the end of the line. It's not the end all be all, the last thing we need to do in terms of healthcare. In my view, we need to get to a single payer universal care system. And this isn't that, I will admit that, but in my view, it is the next step forward to get to that we are starting to build that public infrastructure and really shifting our care system from, again, one that is driven by profit. And we have, private insurance companies that are making billions of dollars by denying people care. Shifting that to really have it be a system that is focused on care and making sure that all Minnesotans can get the care that they need in an affordable way. So I will stop talking, and I look forward to further discussion about this and hearing the stories from you all. So thank you.
All right. Well, thank you so much, Senator Bolden. That was great. So I'm going to talk a little more about our current system and something that I call deprivatization. So I was going to kind of start out by asking, like I do in many audiences, like, who likes choosing an insurance plan? Who likes dealing with insurance companies? And who thinks insurance companies are here to actually provide health care to people? And usually, like, nobody's hand goes up. Anybody here wants to say yes to any of those things? Probably not, right? I don't know, maybe the commissioner, because she has to like insurance companies, or at least work with them, tolerate them. But I wanted to just explain a little bit right now. When you are in a Minnesota public health program, in other words, Medicaid, which in Minnesota we call medical assistance, or the Minnesota Care program, which is a pretty special program we have here in Minnesota, in either of those programs, you are still probably getting your care through a private insurance company. This is something when I started at the legislature, I had no idea this was the case. But this is how we've been doing it for quite a few years now in Minnesota. We really outsource it to private insurance companies. And we call these private insurance companies managed care organizations, or MCOs. And the thing is, that's kind of a misnomer because they really don't manage much care. They just manage the money. And I very much agree with Senator Bolden. For me personally, and maybe for many of you, having insurance be the way you get your health care is kind of like having a fish riding a bicycle. The two things just don't go together, right? Health care is health care. Insurance is something that really is used to shift risk. And I think historically the idea came from, like, home insurance or fire insurance, where you're spreading a really serious risk over a large pool of people. Because if you're the one that gets the bad thing happening, you should have help paying for it. Healthcare is not like that. We all need it. We're all gonna need it. We all get sick. We all have needs for preventive care. It's something everybody needs a lot of our lives, right? So it just, to me, doesn't fit. So with that background, so we all know Minnesota has about 5.7 million people. About a quarter of them are actually on our public programs. This is a lot of people in Minnesota, right? And we spent, I hope that these numbers are a little fuzzy, but we spent about $15 billion, just state money now, on our public health programs in 2022. The federal government comes in with another huge chunk. So there's a lot of money being spent. And about half of this went to the managed care organizations to pay for public healthcare programs. About 85% of the people, the Minnesotans who are enrolled in our public healthcare programs, are on these managed care company plans. So that the state contracts with these companies and then pays them what's called a capitated rate. So a person who is on the plan, the state will pay a fixed amount of money, say to Blue Cross Blue Shield. We'll have a contract with the state, we'll pay them X amount of money per year, and then they are responsible for all of that person's care, right? So they have essentially the same incentives that a regular insurance company has. Their incentive is to reduce their cost and to keep money. Now the state does oversee them. I don't want to overstate the case here, I probably will, but the state does do some quality control, and there are some things that benchmarks are supposed to hit. They don't meet a lot of the benchmarks they're supposed to hit, actually. So the other piece of this is that they spend a lot of money on administration. So these are companies that contract for a lot of the care that their enrollees are getting. They're actually not providing it. They're contracting, for example, dental benefits people are supposed to get. They hire an administrator to administer the dental benefits. So there are layers of administration, all of which costs taxpayer dollars just to do the administrative piece, not to provide any actual health care. So they have these incentives that insurance companies have. I just had, my committee had a hearing very recently with bringing in experts to talk about managed care because it's frankly been one of my goals for a long time to move Minnesota away from this system and have a truly public system. And that's what I call deprivatization. So we had this hearing, we had the experts, and the bottom line is that there's very weak and mixed evidence on whether managed care across the country improves access, quality, or reduces costs. And I would say in Minnesota, from my vantage point as a legislator, I've seen very little that tells me that we should be doing healthcare this way. The bottom line for me is that I believe we can do better as Minnesotans. We can save a lot of money that could be used to cover more people, to do better for more Minnesotans. We could pay more for things like mental health care. dental care so that people can actually get it when they need it. And we don't need insurance companies in the middle. So I'm hoping that if we can find some kind of really good public option, that what we won't be doing is just putting more people into these managed care companies, because I think it's time for us to really move in a different direction. And my message to you is, I really believe we can do better. Thank you so much.
I'd like to invite Commissioner Arnold to come up.
Great. Thank you all. Thanks for the invitation to be here today. This is really exciting. So most people, when I say I'm the commissioner of the Department of Commerce, they say like, oh, like businesses and stuff. And I say, no, we don't do any of that. We do say that we're with you every day, which someone told me is creepy, but is kind of true. So we regulate state banks and credit unions, financial institutions. We oversee a bunch of energy stuff, but we also oversee the insurance industry in the state. That means all your homeowners, car, all of those kinds of things. My team is looking at those and a portion of the health insurance market. So health insurance is both Senator Bolden and Representative Liebling's side is complicated. Some of the state only regulates a portion of the private market, but what we do is to look at the terms that are in policies, the rates that are being offered, and then approve those to be sold in Minnesota. So we do that in partnership with the Department of Health, and we oversee so I'll fill out a little bit of the rest of the pie chart that Representative Liebling was talking about. About a quarter of Minnesotans get their care through private, or get their insurance through private plans that we regulate in the state. Everyone else gets it through plans like in your employer, especially if you're in a big employer, the federal government would regulate those plans. So extra confusing. And so one of the things that we think about is to try to, knowing that it's extra confusing, trying to do the work that we do to make sure that healthcare, that the insurance people are getting as simple as and as affordable as possible. I'm in the administration, so we are bound by state law. So within what we currently have. So what we are doing this year in partnership with our Department of Human Services, which operates the Minnesota Care Program, is to do an analysis. I think Senator Bolden was talking about. So, in order to pursue a public option, we have to ask for permission and try to get some federal funding. That involves a lot of steps. So we're sort of starting on the first part of those steps by looking at how would a public option be structured? How many people would enroll? What would premiums need to be? What would copays need to be? How can all of this look, and start to sort of build out a scaffolding of what this could look like, provide a couple of options, and then provide that to the legislature to then kind of pick up the ball and do the rest of the policy making. I think, that's a lot of math. It's a lot of modeling. It's a lot of assumptions. But one thing I think is really important is to remember that there are humans at the end of all these decisions. And so I'm really grateful to be here today to listen to some of your stories, which, we will then, I will hear, my team has attended, I think, or is attending a couple more of these. And that's really helpful for us in trying to put a human flavor to, or a human perspective to what we have been tasked with, which is to have a report which can be kind of dry. But at the end of the day, people are getting healthcare, and that's the important part to all of us. So I don't need to talk anymore. I'm really grateful for the opportunity to be here to listen to the stories. And I really love this definitions thing on the back. And so just really grateful to be here to listen. So thank you.
Thank you for grounding us in what our topic is tonight. But what we'd like to do now is we'd like to hear from 5 community members, and we're going to start out with Tiffany Charles.
Well, this isn't nerve-wracking at all. I appreciate the human factor. I am a human. I'm not a professional public speaker, so bear with me. I'll do my best. In fact, this is my second time being in front of a group other than my coworkers. I appreciate the opportunity to share and that you will listen to my human story. Um, and passing on this information to some of those that don't really understand us little guys. I have the pleasure for working for Cardinal, Minnesota. I'm a residential supervisor for providing services for disabled adults. And I'm passionate about the people I serve, my coworkers, and the company that I work for. Health insurance has been a deciding factor in many choices in my life. For example, I choose to work part-time in a non-benefited position so I can keep my state-funded medical assistance that I qualified for with my first child 17 years ago. My partner that I've been with for 9 years, and I wouldn't be able to afford the healthcare premiums offered by our company separately if we were to ever be married. So that's definitely, well, not the only reason why we're not married, but it's one of the factors. Finding mental health providers that are both accepting new patients, but also patients that are on these medical assistance programs is difficult, especially for children. If you have a child, a teen, particularly the 13, 15 range, there's very little available for that. Because it's my understanding that they have to receive a lower reimbursement for state-funded insurance programs. So they often will just say, we don't have any openings, but it's right after the question of, what's your insurance company provider? UCare? And is that a Minnesota healthcare program? And then the door is shut. My administrator, so my boss's boss, she's not able to be here tonight, but she asked me to share her experience with her high cost of insurance that she purchases through our employer. She spends roughly $1,200 a month in the premiums and out-of-pocket prescription drug costs that aren't covered alone. This is only for herself, not even her kids. She needs medications that would better treat her chronic conditions, but she would have to pay as their non-formulary $800 to $1,000 a month on her own. So she just chooses what option is covered and still ends up paying $300 a month just for prescription medication. And I know I've heard at the end of the drug companies ad advertisements where they say there may be a help for paying for, you can apply for this, but now this woman who works 80 plus hours a week is going to go home and spend her precious family time searching for this program. It seems a little ridiculous. Just got my 1 minute notice, so I'm trying to pick what I need here. I choose to stay in my profession. Accepting low wages is not a reason why. I wish to advance it within my career. I would need to pay for additional childcare, which would easily $200 a week. And my chronic medical conditions, I wouldn't be able to afford to treat them. So I just, it'd be kind of tough. So I can't afford to advance in my career. How absurd is that choice for me and my kids? So my socioeconomic status should not determine whether I get quality health care or in fact how I receive it, how I receive my treatment. Childcare providers and workers providing services to disabled adults need access to affordable health care. Thank you for listening to me.
I just want to say, I think Tiffany brings up an important point when it comes to, she would work full-time, but it's that health insurance that is the roadblock for her and her family. So now I'd like to introduce Catherine Holger, and she goes by Kate.
Hi, thank you so much for allowing me to speak today. This is an issue that's very personal to me. I'm a community health worker and MNCare navigator. Sorry. I'm a community health worker and MNCare navigator at a small employer in Minnesota, and they don't offer health insurance, so I have to buy health insurance through the MNCare marketplace. I have several chronic conditions, and so I need good health insurance. So I spend almost $500 a month just on my premiums, not my copays or medical um, medicines, etc. Um, and so that's inhibiting for me. I'm not able to live in Rochester because I can't afford it. But not only is this a personal issue, I work with many clients and patients that face a lot of barriers to healthcare because of their health insurance. One patient that I work with is struggling with severe um, mental health issues and is not able to work much because of her illness. She makes too much to be on Minnesota Care medical assistance, but um, doesn't make enough um, to pay for a great healthcare plan if that exists. Um, and so we just got her a healthcare plan with a bronze medal level that she might be able to afford and starts in February. Um, so she has a lot of emergency room bills and just an exorbitant amount of healthcare bills that she won't be able to pay. So we'll have to work to figure out how to pay those. I also work with a patient that has several chronic illnesses and is disabled. She was on medical assistance for employed persons with disabilities, but when the renewals came around after the pandemic was declared over, um, she was no longer able to work and so was kicked off this MA program. Um, so now she had to get a Medicare supplement, which doesn't cover nearly as much as the medical assistance did. So she has to choose which appointments she's able to go to. I really firmly believe that everybody deserves affordable health care. And I'm hoping that this program is a step in the right direction. Thank you so much.
I just want to say that Kate is doing some great work in our community for people that struggle. So I appreciate everything that you're doing. I'd like to introduce now Melanie Brennan.
So hi, I'm Dr. Melanie Brennan. I'm a physical therapist of 25 years. I've worked in many settings, including 12 years at the Mayo Clinic and now 14 years in my own community physical therapy practice. Through my years of working in the insurance-based model of medical care, I grew really frustrated. I was constantly being told how to manage my patients by reviewers at commercial health insurance carriers. Not only were they non-physical therapists and they're managing how I treated, but the length of time that insurances were willing to pay for acute and especially chronic conditions shrank over the years. Increasingly, my patients only wanted therapy care as long as their insurance covered it. Sadly, choosing to go without therapy, they were too often returning to me 6 months later or so with decreased health and function, requiring a new bout of PT, more cost. I knew that if we would have been allowed to continue intervention, they would have improved their health and function instead of worsened. This constant cycle of regressing health and mobility due to lack of access to adequate therapy services created by insurance companies' decisions is one of the largest reported dissatisfactions of physical therapists in their careers. I could not personally continue to work in this system. In 2011, I left my job at the Mayo Clinic to open my own PT practice here, Exercise Abilities here in Rochester. I had a dream that I could provide a place where people living with neurologic conditions and chronic health conditions whose insurance coverages was waning, that they would still be able to get the necessary therapy and wellness support lifelong to continue their health and well-being journey. As my team grew, managing the high cost to deliver quality care for a physically demanding population grew very difficult. I quickly learned that I had no clue how hard it was to run a business in our dual commercial government system of health insurance. The amount that we were getting paid by commercial insurances for physical therapy began to drop drastically after I opened my practice. I attempted to negotiate with insurance companies and all the commercial networks here in Minnesota, but I was told over and over by all that they no longer negotiated with small private clinics with my level of service, and that I would have to be happy with whatever they provided for the fee schedule. I was shocked that they had paid no concern to the high cost associated with treating my difficult clientele. And they needed, and what they needed, or what I needed to sustain my practice. I was never asked, how much does it actually cost? It became difficult for me to charge enough for cash pay wellness services to balance declining insurance reimbursement rates. By 2015, I was still not able to pay myself any salary after 4 years in business. Instead, I gave all of my income to my staff and I paid for their benefits. I needed that because I needed to keep them employed and not go to the larger healthcare system right in my own backyard. I was forced to make a hard decision at that point. Should I close my doors on a growing business with 10 employees and over 300 active clients, or transition my LLC to a nonprofit so that I could start fundraising to support reduced fee access to essential therapeutic health supports? Well, today I can say that we did transition to a nonprofit in 2015. I'm a modestly compensated CEO operating a full-time fundraising, or I am a full-time fundraiser now, not a PT any longer. I support my company through, in the past 2 years, I fundraised $3.5 million to provide these services, to support an endowment and continue to offer significantly low fees so that people can continue to come and see us. Despite this fundraising success, we had to end our OT and speech therapy practice for children last year. It was pretty devastating, but due to the poor reimbursement that the children received, mostly Medicaid, but also from commercial insurers, we couldn't make up the difference in fundraising. So that department we did have to close. I do want to close with a specific example of the failure of the current unchecked commercial health insurance system for citizens in Minnesota. The CDC suggests that the majority of healthcare is delivered in the community at a community provider. This community delivery is less expensive and more accessible. Unfortunately, community providers receive on average 70% less reimbursement by insurance companies. Short story, in December, my daughter had physical therapy at a large system right in our backyard. One code was charged out $124 for a 15-minute code. They got paid $111. At EA, we charged the same code in December to someone, and we charged $67. We got paid $33.50 for that same code. The system is inequitable. Small providers are closing their doors. The cost of care will go up. I had to pay that deductible. The visit totaled $330. At EA, it would have only cost $168. So let's keep private small clinics open so that your access is possible.
Thank you, Melanie. It really shows your dedication to members of our community. I'd like to now introduce Stephanie Whitehorn.
Okay, give me a minute before you put the little card thing up on me. I'm a look away. It worked well for her, so I'm gonna look over here. She said what she had to say. So I want to say first off that so I was looking at what this is about and how can I help and what can I say, right? So we're looking at, a profit-centered structure versus a people-centered structure. The first thing that I have to say is you cannot build your brand and help your community at the same time. Anything with two heads is a monster. So we cannot have both. So there's going to need to be a decision that is made. I come as a small business owner. I come as a woman who has and is currently on Minnesota healthcare plans and has also been a part of the private sector. So as a small business owner, it's unfortunate that we cannot employ people and take care of them how we want to. That's pretty much what it comes down to. Myself, as many small business owners do, we contract 1099 employees, or we just do it ourselves, which is the majority of the work, because we cannot afford to be able to offer them a plan that is sustainable to keep them healthy. That's really what it comes down to. Because you need to pay in. There are a lot of obstacles as a small business owner if you do truly want to offer your employees a living wage, God forbid, and insurance. You're gonna need some big backing and some big dollars. But unfortunately, many small businesses like myself are not in a position to be able to do that. So we work ourselves to the bone, and then when we get sick, we shell out the thousands of dollars, right? As a person who has had benefits on both sides, my short story is this. So many years ago, I had a daughter who was having some health issues. We couldn't figure out what it was. She had Minnesota Care. I was getting very frustrated. Appointment. You got to keep going back. Everything you got to get a referral for. It was becoming overwhelming. I was approached with an opportunity to do that would be able to offer me insurance. So I took that job so that I was able to get the insurance, but I wasn't able to, as the woman before told, I wasn't able to maintain it due to the high cost. But I had to do something short term so that my child could get the necessary care that she needed. I will be 100% honest. The reaction, same doctors, I ain't gonna say no names, but the difference in the way I was treated, one, from going from a public program to a private program, astronomical. Amazingly, all of these new tests and things came up that they could have done for my daughter that apparently under the other insurance, it didn't even show up on her chart. But when my insurance changed, all of a sudden there were a whole bunch of new procedures that could be covered, and they were great procedures. And guess what, y'all? Within a few months, they figured out what was wrong and my baby was better. Disheartening, right? On the flip side, we've had private insurance. My husband, we paid in for years. We had our short-term disability, had a full knee replacement, $15,000 of unpaid wages, never got paid. But we paid into the private insurance. We did it that way. So as some people say, we had, hey, we'll go back to the public option because we're paying in and we're not getting any help. But I just want to leave with this one little thought. That a people-centered option is designed to empower people. None of what I just shared with any of you was empowering. It's not empowering for me as a small business owner to not be able to offer my employees what I want to offer them. It's not empowering to me as a mother to not be able to get my daughter the care that I know that she needs, or if it is available that I have to drive all the way to Northfield to get it. It's not empowering that when I pay for my husband's insurance and we make the sacrifice to pay the premium, we still don't get back what we need. So we cannot have both. It's going to be one way or the other. You either are going to empower the people or you're going to be more concerned about your profits. Thank you.
Thank you, Stephanie. And I think that, again, you're highlighting how you've got a small business and you want to expand, you want to employ people, and it's all the roadblocks that you and your family have experienced through the years. Next, I'd like to invite up Jen Hazelton.
Good evening. How did I get to follow Stephanie? That's fabulous. I'm Jen Hazelton. I am the chair of the board of directors for Thrive Childcare and Family Resource Center that's here in Rochester downtown. We are a small not-for-profit organization with a mission to provide, of course, high-quality childcare. We also scholarship some of our children who could not otherwise afford it. We are a small business with 18 employees. We cannot provide group health insurance, yet we compete for employees with larger centers, maybe centers that have they're a national chain or something like that, that can easily provide health insurance, or with organizations that have government health insurance, such as Head Start. We also compete in this town with hundreds of employers and one very large one who does offer health insurance. Last year, we had a fabulous teacher who had to leave and find a place that offered health insurance. She did not want to leave. Families loved her. They loved those kids. She loved those kids. But she had to. It was an incredibly sad situation for our team, for our teachers, for the board, and for this employee. These professionals who choose to teach and care for our young children should, at the very least, be able to obtain affordable health insurance. They are the reason that others can work. That makes our economy work, that makes our society work. This is called the public option. What better way to serve the public than supporting this measure, which will keep excellent teachers in early childcare? It seems like a no-brainer to me.
Thank you, Jen. I just admire what Thrive is doing in our community. And you guys are doing good stuff and we got to keep it going. Thrive is actually at my church. So my granddaughter was one of the original 5 people that started at Thrive. So really good work. And it's good work that all of you are doing. And I want to thank everybody for sharing what their personal story is, because that really is what it comes down to. It's the real life. This is what we're experiencing. How can we make positive changes? So now I'd like to turn it over to Alita. She's going to lead us in our next section of the program. And we'll have just a little bit to get people set up here. So we're not assigning chairs technically.
I just wanted to make sure that if people all know who's who. And Commissioner Arnold, I know you have to go soon, but we were hoping that you might start off if you have any reflections. And I just wanted who our speakers, our panelists really are. I just want to tell you that Commissioner Arnold comes with this very deep experience in health insurance in particular. She worked over 6 years for the Centers for Medicare and Medicaid Services, for a private healthcare company that offered private insurance, and then went to our Department of Commerce, where she's been for about 5 years, and in 2020 was appointed the commissioner, or in other words, head of the Department of Commerce. So I welcome our other legislators up too, but I don't know if, given your time constraints, whether you wanted to offer any reflections from what you've heard. And maybe if you want to come up here, or we might want to,
I can
come
do
up
it.
here.
They can get settled in. Okay. So thank you. I really appreciate it. Representative Liebling reminded me that I should tell everyone that if you have issues with your insurance, you can complain to the department. While we are not always, we don't oversee every part of the insurance in the state, but it's always good to remind you that there is like someone who can listen. So if you ever need to, or you think, you have had challenges, you can go to mn.gov/commerce and file a complaint. Particularly, I would say if you buy on MNCare, then we definitely oversee your plan. And if you have a small employer, so if your employer is less than 100, if you're in a big employer, then those are the feds, but sometimes we can transfer you the complaint over there. I think, I think Senator Bolden did a really good job of kind of setting up that there are a lot of balances to try to figure out what actually works for people. And I heard a lot of that today of access, right? Making sure that you can actually access providers when you need them. And that is a big challenge. Getting treated well, I think, was another theme that I heard, which, is probably the most important thing, but the financing of how that happens is something that I've been thinking a lot about, and how we make sure that we have a system that can support actually being treated well. I think it's also important to know that, or just, as a little bit of context, we have, as state agencies under the governor, One Minnesota goals, and one of our goals as the combined health agencies, so DHS, Department of Health, MNCare, and our department, is that we reduce the number of Minnesotans who report discrimination when they go to seek healthcare, particularly Black Minnesotans and trans Minnesotans. But those are things that we are thinking about in those Sometimes it might be because you're on a public program and you can't get in. Sometimes it might be because of, other whole host of things that you might get not get treated well. So I think that I heard a lot of the things that we've been wrestling with in the actual, like in the report, and how we talk about those things and how the math sort of supports the human experience and how we're kind of thinking about that. So I really appreciate all of you sharing your experiences. And the themes that I heard were, access, getting treated well, and then actually just being able to get into the care that you need. So definitely things that we're thinking about as we're doing this report. And you can always file a complaint.
Well, yes, thank you so much, Commissioner Arnold. And I would say that, am I right in saying that our Department of Commerce is really our main consumer protection agency in Minnesota? So it's the right place for us to bring our concerns about commercial insurance, especially in this marketplace where we've heard stories of, people. I know I've heard so many stories from farmers who are on Minnesota Care and it's great, and then all of a sudden they make too much money and they completely fall off the cliff and go into debt and lose their farm. So this is one of the things that I know that people are grappling to fix. So I really want to welcome up our legislators, and let me just give you a little background about each of them, because they are all really exceptional individuals. Representative Tina Liebling is chair of one of the most important committees in our legislature. In the Minnesota House, she chairs the Health, Finance, and Policy Committee, which oversees all of the healthcare public dollars. She's now in her 10th term. She has a master's in public health, so I consider her really one of our policy wonks in the legislature. Senator Liz Bolden is a nurse educator and a nurse leader. She's assistant majority leader in the Senate and sits on the Senate Health and Human Services Committee. And are you co-chair of the Minnesota Health Plan in the Senate this year? She is. She is one of the co-chairs of the Minnesota Health Plan, trying to build a health system in Minnesota that serves everybody in. And Representative Andy Smith is an advocate for the needs of small businesses. He's a small business owner himself, and he's also co-chair in the House, in the Minnesota House of the Minnesota Health Plan Caucus, and sits on the House Health, Finance, and Policy Committee with Representative Chair Liebling. I just want to add that Representative Kim Hicks wanted to be here. She has a sick kid, husband is away. She has been one of our most important vocal advocates for people, our most vulnerable and our disabled, and sits on the House Human Services Policy and Human Services Finance Committees. She gave me a statement, and I think I'll wait to read it after I've given these folks a chance to maybe reflect on what you've heard. And we're so grateful that all of you are here today. Thank you so much. I'm seeing Senator Bolden's kind of nodding. Are you ready to dive in? And I forgot to even say how wonderful your stories were, and we're also grateful that you had the courage to come forward and share your stories. It's very meaningful. Thank you.
Yeah, I'm happy to. Do you want me to shout or come up there? Or... Oh. Okay. Does this work? Very good. Okay. Well, I too will just share thank you to all of you who shared your stories. It is not an easy thing to stand in front of a room of full of people who you don't know and tell stories that are really personal and meaningful. So thank you for that. Thank you also to Tony and Alita for hosting, and Olivia for organizing, and everyone who helped to organize this. This has been really impactful. So thank you for that. Reflections. One thing I'll share is I really appreciate the theme about bringing it back to that human experience. I think sometimes, you know, the legislature, as we talk about different issues and policy and reports and data and finances, it is possible to lose sight of the fact that we're talking about people. And when we're talking about people's health, there are, you know, there's few things that are more personal than that. So I appreciate that focus, and really sort of the theme I heard is one that I fully agree with, is that we need to move away from a system that is focused on profits, where CEOs and insurance companies are profiting, making billions of dollars, literally billions of dollars, and Minnesotans don't access the care that they need. It's wrong. We need a system that's focused on care. I'll also just add, I wear a couple of hats, and my legislator hat, I sit on HHS, and we have these discussions, and I see it from that angle. I also see it from an angle as a patient and a family member. I have a son with significant disabilities and complex medical issues, and just want to validate that having, chronic health issues and having to navigate insurance companies is like a part-time job. I cannot tell you how many hours I spend on the phone each week with insurance companies. It's infuriating. As we mentioned, the inbox to make a complaint, I leaned over to Andy and said, I'm going to fill that inbox. Because there's those stories of just dealing with, our healthcare system and the insurance companies is incredibly complicated and convoluted, and it's intentionally that way, because what that means is it denies people care. And so I am grateful for all of you to be here, and I look forward to talking about sort of next steps and how we continue to push towards a public option as the next step in getting access and affordable care for everyone, because we deserve that. We all deserve that. Healthcare is a human right. And we can have a different system. It doesn't have to be this way. I think also too, this is the last thing I'll say and then I'll pass it down, but I think one of the sort of the strategies around the system and sort of the grip on the status quo is to like wear us down and just sort of have us be hopeless and cynical and be like, well, it's terrible and it's awful, but that's just what it is. It doesn't have to be that way. So I am grateful for my colleagues and who are here, and Kim Hicks and others in the legislature who are equally as passionate to really transform this system that is harming people every day, and build it into one that we deserve. Thanks.
Thank you so much, Liz and Andy. It's really, I also am really grateful to hear the stories of those who spoke, and each of you has a unique voice and a unique importance to what you're talking about, and really do appreciate that. It's sort of a little bit conflicting with what Liz just said, in that I was going to say, you can complain to the Department of Commerce, but it's often very hard to know even where to complain, what to complain about. I mean, the commissioner talked about, well, if it's this thing, it's with us, and if it's that other, your legislator is there for you to also let us know, because we can find out for you. You don't have to be an expert, and we actually aren't experts. But we have staff who are experts, and they will find out, is this Department of Commerce? And if I call the Department of Commerce and say, hey, my constituent's having this problem, I might be able to get you a little help that you might not otherwise even know to ask for. So please do use us for that. That's how because Liz was like, oh, I'm going to fill there, but I know she knows this too. If she, we use us for that. And we can't always fix it, just to be clear, because we have a system that really sucks. We really do. And, it's super obvious. We need real fundamental change. And I'm also part of the Minnesota Health Plan Caucus. We are working toward a single payer system. In Minnesota, we only have so many tools because it's a big country, and a lot of the money flows through the federal government under the federal government's rules. But there are things we can do here in Minnesota, and by golly, we got to do those things and push the envelope as far as we can and be a leader among the states. And we are really trying to do that. And it's only now, right now, when we have this trifecta that we have, it's the first time in my now almost 20 years that I felt really hopeful that we can begin to really crack some of these issues, like the deprivatization, which I've been trying to talk about for probably 16 of those years since I started to understand what the problem is there. And I finally feel like I have colleagues who also get it and also know that we can do so much better. So I feel very hopeful. I know that when you know, it doesn't help when you have a real issue and you need help now. That's the problem, is that we can't wait for the perfect. We just can't, because people need healthcare when they need it. And so it's a real balancing act to try to move us toward the future and also to try to give people what they need now. And that's going to be our challenge with this public option thing, because to tell you the truth, I'm worried that it's not going to be a great, wonderful proposal, because I just don't really see what that's going to look like that's going to solve enough of these problems. And it really concerns me, because I know many people in the state need care now and they can't wait. So anyway, on that not too hopeful note, I'm going to turn it over to Andy.
Yeah, I'll echo and say thank you so much for everyone who publicly gave their story. And also, I'm sure afterwards, please continue to discuss this. And after tonight, as Tina said, let us know as legislators about this. These kind of events are wonderfully horrible. Horrible because none of us should be here tonight in the richest country that has ever existed, in a mostly thriving economy, at least for the upper classes, where there's a lot of money in the system and $1 trillion industry in the United States. We should all be able to get healthcare very easily, affordably. It should make sense. It should be logical. All of these things is what it should be. We shouldn't be here. And it's horrible to hear about these experiences that all of us have, obviously to various degrees, but it's horrible. I say wonderful because the way that we change that is telling these stories to each other and together changing that. 100 years ago, children were working in factories where they locked the doors during the day so they couldn't leave. We can change things in society that don't work. And at that point, people were saying, we can't do that. The economy will collapse, businesses will close. And today, I've only been in office for like a year. I've had a lot of executives come to me in very expensive suits with nice watches and say they have no money that they can keep their hospitals open if we do this single payer health system, or insurance people saying we're spread too thin. And then, I can go to Wall Street and see that they literally are having billions of dollars of profits. And so to fight those, let's call them what they are, lies that we're being told, we have to tell the truth to each other and continually tell the truth to each other, continually tell the truth to each other, and tell the truth to the power, continually. And that includes you guys to us, push us, because we need the encouragement, and sometimes we need to be corrected as well. And that's how we can change that. So thank you for coming tonight, and keep on the pressure. And that's how we get change.
Ooh. I can't tell you how fortunate we are to have such incredible leaders on healthcare here in Rochester. We're very fortunate. What I would say, and I think many of us, one of my Chair Liebling's hesitation, but I think about, this is MLK week, and every struggle, every victory that we have for justice, for a more just, equitable society, doesn't happen without a struggle. And that's what part of this is about. It's trying to raise this awareness and voice, and that even if a public option is only a step for some, we've got to start by building the steps that can get us towards the system that everybody deserves, that's not so fractured, that doesn't leave people. I'm thinking about you, Stephanie, talking about, it's, on either end, maybe things are not working for people. And we need a system where, as Representative Smith says, there's enough money in this system. There's enough money in this system to care for people in a way that is dignified and that people deserve, and we need to fight for that. I think, Olivia, do you have a walking mic? We might have time for a few questions, so you think about them, and I want to read Representative Hicks' statement to you, and then we might have a time for a few questions. Okay. Well, anyway, I know that Representative Hicks really wanted to be here tonight, and again, she couldn't because of family circumstances and ill child. She says the opportunity to create a true Minnesota public option is near and dear to my heart. My youngest daughter has a rare autoimmune condition called mast cell activation syndrome. This condition made her extremely ill as a baby and required that she utilize medical treatments and formula to stay on the planet that was in excess of $550 a month just for those formulas. Our commercial employer self-insured plan that we had did not cover the formula necessary to keep her alive, and she could eat nothing by mouth. We were faced with thousands and thousands of dollars in copays and deductibles and the cost to keep her alive. I ended up working 2 full-time jobs, one as the program manager of SEMSO, that wonderful organization that advocates for people with disabilities, and the other as sleep overnights at Cardinal of Minnesota. I worked 80+ hours a week caring for others so my daughter could live. I had to have Cardinal's health insurance to be able to keep her alive. Without the coverage, she would have starved to death. That insurance was extremely expensive but necessary. I was lucky to have the option to choose an insurance that would cover her needs. It covered her needs because it was regulated by the Minnesota Department of Commerce. The employer self-insured plan was not. I worked 38 hours a week at Cardinal every week and received a paycheck of $200 every 2 weeks. Excuse me. Because my entire check went to pay for our health insurance. I continued to work full-time at SEMSL as well. I need some water.
And in the 9 months that we accrued over $15,000 in medical debt, every dollar from my work at Cardinal went to pay the medical debt. We didn't have a lot of money, but because my employer offered insurance, even if it didn't cover what she needed to stay alive, we were not eligible for MNCare, Minnesota Care, and we were over income for Medicaid. We had no choice. We need a true solution to our healthcare inequalities where everyone can access and afford comprehensive healthcare that meets their needs. I am honored to be working with all of you to move this goal forward.
So I think we might have about 10 minutes for questions. I think Steve has a question.
Okay, my question is, do we have legislation prepared? What kind of state is it in? And do our Democratic colleagues in your caucus support this? Do we have the data to defend it as well?
What's what is this in that sense?
Do we have legislation to advance a public option in Minnesota?
Yes and no is the easiest question. I literally have a spreadsheet of bills I could send you of stuff that touches on various aspects of how we get to a real public option that we are helping. What I think Tina would want me to say is there are some bills that don't deprivatize, that sort of make what we currently have like a higher income limit or something like that. That's sort of the bills we're currently working I think at this table, we would want to go to what we would call a real public option, where it's administered outside of these managed care companies. We don't have a bill right, correct me if I'm wrong, there's not a bill right now that has that fully as it currently is. And part of that is that there are a lot of different ideas about how to get there. So that's a short answer. That could be a very long answer.
So the legislation that was passed last year that initiated the study that Commissioner Arnold was talking about essentially said that the administration, her department, would recommend something in a report. And then if the legislature does not act, the administration is authorized to go ahead and apply for a waiver, for the federal permission to do whatever it is they decide should be done. So it's really unclear right now. We don't know what will be recommended. We don't know what the cost of it will be. So we don't know if it'll actually be doable. It's not a budget year, but so I just don't know if something will go forward or not. And depending on, I mean, we'll all kind of have to make a judgment about what are they proposing that we will get for Minnesotans for whatever money it would cost. Because, so I think what Andy's talking about is that there's some concern that right now when you're in Minnesota Care, you go onto a private plan, just what I was talking about, we have a privatized system. I'm concerned, and some others are concerned too, that what they will recommend will be another privatized system. And then we'll have to make a judgment about whether that's enough benefit for whatever the cost is, and what does it cover, and does it give people what they need. And that's what I'm just concerned about, is that in our broken system with the money going, so much of it not for healthcare, and there being so much real waste in our privatized system, that we really won't have the resources to make a big change. It'll be just another version of kind of what we've got now. And that's my concern. So I would just so love to have, I think that the way we move forward toward a truly universal system is to simplify, not to make things more complicated. We have a really complicated system. It needs to be simple. It needs to be, you need healthcare, you get it. It gets paid for some way that you don't have to worry about. That's what it ought to be.
Agree with that. The only thing I would add is just sort of underline what Andy said about there are many bills that are sort of touch on this, pieces of it. Dr. Elise Mann had a bill in 2020, I believe, and when she was in the House. And so there is work going on around this, and we'll see what the report shows, but there are different thoughts about like what it should look like, what it should be, all of those variables, who should it cover, what should it cover, what should the rates be, all of these things. And so we'll continue to have work and discussion on that. And the last thing I would add is, in my view, it needs to be a dual track. We have to do more than one thing at the same time. We need a public option that is truly public, that is administered by DHS, and we need to build that public option to start building the public infrastructure, and we need to deprivatize all of our public systems. We have to do both of those things, and I believe they can go together. We can do big things, and we will.
Walk and chew gum.
What I might add to that, and I tend to agree with Senator Bolden, we don't want managed care profiting from our public dollars, for sure. And yet we can't flip a switch today and have the system we want. It's not, so we have to begin building it. And so I agree that there's two prongs that need to be kind of be pushing at the same time. But what I would also like to say about this is that we would not even have the Commissioner of Commerce in this room if there hadn't already been 3 other listening sessions across Minnesota that she's heard about, and understand that people are demanding something better from our healthcare system, and especially given the public dollars we're spending for healthcare in Minnesota, and that people are suffering so much, whether you have employer-based insurance or not, you're suffering. And so this is a step forward, and I feel like we are at a critical juncture here, having gotten, in fact, the expansion of Minnesota Care that we've been fighting for as long as I remember, that I worked with the farmers on. We've not gotten to this point before. And I'm afraid if we don't get what I think Senator Bolden is talking about, that Minnesota Care public option, we're going to go backwards. And so that's the fight I think that we want to have right now. And we need you in it, frankly. As I said before, we can't change a system without struggle, and we need you in it. So what I might just do right now is, unless there are, I think we'll just jump into what I would say is our next steps sheet, and I want everybody to take a look at it, because we need you in this, if everybody's going to be in, regardless of where they live in our healthcare system, what they look like, how they got here, we need all of you in this fight with us, okay? So there's important things, one, are you willing to share your story? Not everybody who has a story in this room could tell Commissioner Arnold their story. But if you have a story, you fill out one of those cards and we'll make sure that she gets it. Okay, we will share that with her. And then the other thing is, if you're on social media, you might take a picture or say I was here and share that on social media. We can help you submit a letter to the editor, to our local paper on this issue, because after all, this is Rochester. Our voice in this room makes a big difference in Rochester, and there's even a letter to editor training that will be happening later this month. The other thing is, we got this far because, in fact, there was huge amount of pressure at the legislature last session for this, and all the other amazing things that happened in our legislature last year. It happened because people showed up. People were present. So many of you were there present, at the Capitol, talking to your legislators, showing up for rallies. So we're having a big public option healthcare rally on February 20th. So, please come join us for that. And then this coming Sunday night, we're having a meeting at my church. It's the core, as we say, the meeting of the Isaiah group, and we have a healthcare subgroup, and we'd love to have you with us to help build this. That's, you see it on the next step sheet. And then, in fact, if you just want to know more about the work we're doing, and have a lot of questions about what this bill really is and how it will help people and what's our strategy, some of us on the healthcare team would love to sit down and talk with you about that. So take a few minutes. I don't know if people have questions about these next steps, but we'd love to have you fill that out and join us in this work. Tony? Oh, next Sunday, do we not have enough? I think we should. It's at my church, First Unitarian Universalist Church on Walden Lane, at 5:30. Okay. 5:30 to 7:30. We'd love to have you join us if somebody needs one of these and doesn't have it. But especially we'd love you to fill out your own healthcare story that we can share with the commissioner. Any last parting words? I think Tina is
Well,
eager to.
You know, it occurred to me that sometimes, first of all, we need to put Minnesota in perspective. Minnesota is really honestly doing a lot better than a lot of the country, which does tell you how badly the rest of the country is doing. But I just want to really invite people to be sure that you are exploring all the options that you have. Sometimes people don't even know that they're eligible for public programs or some kind of help through the state. And a good way to find that out is to reach out to a navigator. I mean, there are some different sources of information, but we have this terrible broken system, but sometimes it does offer people some help that they need. And in my legislative career, sometimes I really have been able to help a few folks here and there to get something that they really needed that they didn't know they could get or that they needed an advocate for. So I just want to make sure that whatever is available, that we aren't leaving it on the table when people could be taking advantage of it.
I know that we had Kate speak and she's a navigator, but if people are looking to find a navigator, can they contact our elected officials?
Well, I think
Or is there an easier way?
Yeah, I mean, they could, but what I would do is direct you to the MNCare website where you can find a list of navigators. I think that's the best way to do it. And so, I don't know, here in.
I literally just Googled find a navigator, and it's the first thing that comes up is that page specifically. So again, yeah, they might not have the exact answer, but they are incredibly knowledgeable and they really know their stuff. Sorry.
Good, perfect.
Yes.
I know Alita mentioned that you're on social media to share these stories with folks. We live streamed this event this evening. You can find a video recording of that live stream on People of Hope ELCA's Facebook page as well as YouTube page. And you can share that freely. So that's a resource that's available to you as well.
Yes.
The last thing I'll say, Alita, if I could just put in a final word, is to just put in a plug for the follow-up steps. The three of us here, take a vote on legislation. That is like the last step for things to happen. The big work, the heavy lift is that everything that happens before that, and that takes all of you. Like the three of us plus our colleagues aren't really the ones that can do it by ourselves. As Alita mentioned, change takes struggle, and it takes all of us to be in the fight together. And so I'm grateful for all of you to be here tonight. I encourage you to stay in the fight. Talk to your neighbors, talk to your family, talk to your coworkers, because this is a big lift, and we can do it, but it takes all of us working together.
Thank you all, and I just want to thank Pastor Daring and is it Melissa? Yeah, for hosting us here at the People of Hope Church tonight, and for all of you for coming, and for all our speakers who shared stories, and our legislators. Thank you so much.